So your bird's been prescribed a medication. That means that you've been sent home with medicine and a syringe of a given size. The goal here is to get the medicine into the bird's mouth without the medication ending up all over the walls. If you're really lucky and your bird is not afraid of the syringe, you can have the bird come right up to the side of the cage and take the medication out of the syringe. We're not so lucky today. So we have a plan B. What you're going to have to do is get your bird out of the cage and gently wrap it up in a towel and secure its head so that you can put the syringe directly in its mouth. It can take some practice, it can be frustrating, but as long as you're gentle and you try again, it will eventually work. So for example, for Sammy, we have 0.2 mLs. 0.2 mLs is the same thing as 0.2 cc's, so don't stress out about that. What we want to do is put it right inside the mouth and just a little at a time, let it fall onto the tongue, taking care not to let it go into the bird's breathing hole, which is at the base of the tongue. Be patient, it can be difficult. If your bird should happen to spit all of the medication out, then you'll just have to draw it up and try again. Alternatively, you could try with a little bit of water first to make sure that you've got the technique down. We just want to make sure that you and the bird don't get hurt. So if your bird should be prescribed an injectable medication that you have to do at home, you assemble the syringe and the needle and secure that it's on tightly. Take the cap off and we're going to stick the syringe and needle into the bottle and pull back. This bird is getting 0.05 mLs, which is also the same as cc's. And what I like to do is put too much to start and then push back in what I don't need so that I don't have air in the syringe. So this is 0.05 mLs of medication. So I'm putting it into the muscle of the bird beside the keel, and we pull back on the plunger of the syringe to check for blood, and there's no blood in the hub of the syringe. So now I'm pushing the injection in, and as I release, I just hold a little pressure on the injection site so it doesn't come back out again. Doing anything to your bird that they don't want done can be very difficult, and medications is no exception. So if you need a partner to do an injection, an oral medication, or help you groom your bird, make sure you do a teamwork effort. When I visit birds, either for a house call or if they come to me in the office, a lot of times we use a towel to hold and even restrain a bird. Unfortunately, many birds are afraid of the towel because the only time they have an experience with the towel is when I'm going in and grabbing them with the towel, which is not fun for them. You can use a towel at home to play with your bird. You can wrap it over your bird's head and play some peekaboo. You can just use it as a toy. You can have your bird step up on your hand with a towel. If you can take away your bird's fear of towels, it makes my experience with your bird a lot easier.